Hello everybody, this is a CGSN podcast and I am Professor Rajiv Sinha working at Institute of Child Health, Kolkata. I will be speaking on an open label randomized control trial recently completed by our institute looking at HPA Axis in single versus divided dose prednisolone for first episode nephrotic syndrome. Corticosteroid remains the mainstay for many disorders despite its well-known side effects. Although steroid-sparing strategy is the best option, one should also explore all possible avenues to reduce steroid toxicity. Hypothalamic pituitary adrenal axis suppression, that is the HPA axis suppression, is one of the known side effects of prolonged steroid uses. It has been well known for a long time that endogenous steroid levels are at their peak during early morning, and hence synchronizing administration of any exogenous steroid with our physiological steroid peak results in less HPA axis suppression. Despite being a known fact, this has not been systematically explored in kidney diseases. We recently conducted a randomized control trial among children with first episode nephrotic syndrome. We tested whether giving steroid in a single morning dose leads to less HPA axis suppression than giving steroid in two divided doses, that is morning and evening. HPA axis suppression was assessed by Sanactin test, which was conducted at the end of 6 weeks of daily steroids. In total, 60 children were randomized in 1:1 ratio to receive either single or divided dose steroid. And at the end of 6 weeks, what we found was that children on divided dose steroids were more likely to have HPA axis suppression. Apart from this finding, we did not find any difference in time to remission or subsequent relapse rate between the two groups. But although this was not the primary objective, our study did show that children who received single dose steroid took significantly longer time to relapse in comparison to those who received divided doses. In summary, our study does show that the HPA axis suppression is more in children who are receiving divided dose steroid, and our study should encourage future research to focus on the benefits of giving steroid in nephrotic syndrome in a single dose in the morning. Thank you.
This podcast is copyrighted by the American Society of Nephrology. All rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare professional if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast from the American Society of Nephrology.